If you're like most folks Dr. Kris Fusterhausen works with, you're active, you want to take ownership of your health, and you want to age gracefully. The problem is there is so much conflicting information out there about health and wellness, it's tough to know who to trust. Most providers are limited by what insurance will approve, so it can seem like they're only able to help you manage your health decline with more meds. On the DrKris.Life podcast, you'll learn how you can regain your confidence in your health journey. You'll learn helpful knowledge about programs, supplements, peptides, and hormones that Dr. Kris has used with thousands of patients just like you to help them crush their goals and be their best selves. So if you're ready to take charge of your health and are wanting to stay active and healthy so you can be a better parent, partner, or lover, then you're in the right place. Welcome to the Dr. Kris podcast. Welcome, everybody, and we're live. It's time to get back with Dr. Kris. Dr. Kris, we've been off for a couple of weeks. I've been looking forward to this. Tell me where you've been. You've been on vacation for 2 weeks, or you've been working, hustling? What's up?
Yeah. I like the former. I wish that were the case. And so I think actually you may have had a vacation one of the weeks. Yes. And then last weekend we were we were up in Chicago for our latest peptides mastermind course. So we were up there and we got back Sunday and just been a busy week trying to catch up.
Well, good. I'm excited to get back in the groove with you. You know, right now everybody's out in the sun. So on my vacation, I was in the sun a little bit, and I'm actually starting to have a little peeling, and it's been almost 2 weeks now. And so a lot of people are wondering, should I be tanning? Should I be taking spray tanning? What are the things that I should be doing? And so the topic of this episode is, what are the real dangers of sun and booth tanning?
Yeah, so it's always a valid discussion this time of year because it's certainly when we're all trying to get a little better tans. And there's always that fine line of having enough of a tan that you have at least some protection from the UV rays when you go out versus maybe the paleness that I am right now, where I barely get out in it and I get burned. The first thing I'd like to just say right off the top is the dangers of tanning bed tanning booth tanning. It's one of the absolute worst things a person can do for their skin. We're actually really lucky. Just a few years ago, I want to say in the last 3 to 4 years, Texas actually made it illegal for anyone under 18 to actually use a tanning bed commercially. Up until then, there really, as far as I know, weren't any real rules on who could tan. And I always tell the story of, because I unfortunately, before I knew better, used to use tanning beds. And I remember I was in high school and I had a girlfriend who said, "You're way too white." And so go to this place, and I go in, and I'll never forget, the lady said, "How long do you want to go for?" And I'm like, "I don't know. What do most people go for?" She said, 20 minutes. And so, okay, 20 minutes. Pale as I am, never been in a tanning bed, 20 minutes. You can probably understand how that turned out. It was horrible. It's one of the worst experiences of my life. I mean, I peeled. I couldn't wear clothes. It was just horrible. And so, but tanning beds, sure, a lot of, especially younger patients, like it because they get this tan, and what's that old saying? Tan fat looks better than non-tan fat. So everybody thinks they look better with a tan, and maybe we do. But you're causing so much damage. And many times we still see these patients in our practice who've been using tanning beds. And so first of all, what's the damage? We're really raising our risk of cancer, skin cancer, melanoma, basal cells, squamous cells. And of those three, the melanoma is the one that we really are concerned about because that is a life-threatening cancer. Many young patients can actually die or will die from melanoma. I lost my own father to melanoma. So it's a really tough disease. It's very progressive. Many times people will have these little lesions on them and they don't think anything about it, and they let it go a year, 18 months, and they go in and like, oh crap, you have melanoma. Because melanoma doesn't really spread so much on the skin. It spreads into the dermis of the skin. And that's why, like so the normal kind of skin cancers that patients get, squamous cell, basal cell, I always go, those are the ones that look bad, but basically just got to take a hunk of skin and sew it back together and you're cured, or freeze it if it's really early. Melanoma is the one that goes down deep, and so that's the one that we don't want any skin cancers, but we're really concerned about the melanoma. So your tanning bed tanning is obviously raising your risk tremendously of those cancers, but it's also just aging you. And so I can usually tell the tanning bed patients that have used it fairly religiously, they will look, when they hit about 40, 45, they will typically look 10 to 15 years older than they really are. They'll start getting that leathery skin, that thickening of skin. It just, it just doesn't look good any longer. So, it looks good in your early years, but you're really causing a lot of damage to the skin.
So you're listening to or watching, it's Peptides and Age Management with Dr. Kris Foosterhausen. His clinic is the Research Clinic. And just wanted to remind everybody that these conversations are intended as educational, and you should always consult your physician before you change anything in your medical program. And today we're talking about tanning. It's on everybody's mind. We're getting out in the sun. We're starting to be more active, but yet there are things that we need to be avoiding. There's things that we can do to improve. So why is it that it takes so long for damage from being in the sun too much for the damage to show up?
Well, the good news is we have a lot of protective characteristics with our body. I mean, I would say it's just like your liver. The first drink or two doesn't cause you the problems. It's the years of damage. And so luckily our body is able to regenerate and repair and luckily, truly withstand the damage that we put it through. But there is a breaking point for everything where that repair mechanism just simply isn't there, especially as we get older, and things that contribute to that. And the main thing is age, but as we start to lose our collagen elasticity and the skin just isn't doesn't have that elasticity any longer, we start to you get more wrinkles and lines and that real just leathery look. Whereas if you'd have treated your skin well, like my wife is fanatical about this stuff. And I used to make fun of her because we had our 20th anniversary yesterday. And so 23 years ago, when we first started together, I'm like, good Lord, this woman spends like 30 minutes in the bathroom putting all these lotions on. But now that she's 49 and she looks nowhere near 49, I'm like, well, I understand it. She had a mom that really hammered on her how important it is to take care of your skin. And that's one of the biggest things because we can certainly help the 45-year-old, the 50-year-old, the 55-year-old to any age. We can help them. How much we can help them is dependent on where they're at with how much damage they have. But what we really like is when we get our hands on the 20, 25-year-old and start teaching them proper ways of skincare, sun blocking, not just, like, I don't know about you, Steve, but, as a kid, you'd hear people like lathering up in like Crisco and laying out in the sun. Mm-hmm. I always remember that. I don't know if you're a Seinfeld fan, but where Kramer, like, I think he put like butter on him or something, and because of the chicken place or whatever. But people do crazy stuff to their skin back in the day because they just wanted to get that tan. And there's just better ways to do it today. But we do typically want some form of and my dermatologist may disagree with this, but I always say in my opinion, if we do it the right way, there's okay to have some form of a tan so that we look good, but also giving us somewhat of that protection so that, because it's great to say, hey, everybody, apply sunblock anywhere the sun is exposed to before you go outside. Is that realistic, though, is what I always say? Are most guys really going to do that? And my answer is no, because I don't know about you, but like my staff got mad at me the other day because there was a male that was looking at the sunblock that we sell, and he's like, Doc, do you use this? And I go, I should, but I don't. And they go, he didn't buy it because of that. And I'm like, well, I mean, I'm being honest. I should wear it, but I don't. I sometimes do. I should wear it. I should put it on every day. I agree. It's just, I'm busy. I'm a guy. I don't like lotions as much as the ladies do. And so, but that was a long answer for, as we just get older, it's just repetitive damage that there is a breaking point with every system. If it's the heart, it's the lungs. I mean, our biggest organ system is our skin. And so, I mean, there is a breaking point for everything.
So I think that having a little bit of a tan shows that you're active.
Mm-hmm.
It maybe shows that you're healthy or you're energetic, or at least you're outside. You're not on the couch eating potato chips. And so, right. So what are some of the things that you can do that are alternatives to being out in the sun a bunch, but you still get the benefits of the perception that you're active and more healthy?
Well, so I would say, getting sun in small clips versus long exposure. So, instead of literally going out to the backyard and laying on the lounge chaise for, 2 hours, for an hour and a half, and then flipping over like a lot of the ladies do, that's probably not the best way to go about it. But giving yourself short exposure times, because a lot of us 15 or 20 minutes at a time can get us some sun exposure, but not give us as much damage as if we're spending those long periods of time. So the first thing I would probably say is just more frequent exposure, but shortening the exposure time. I think that would be an important thing to look at.
To natural sun, right?
To natural sun, yeah. Because, we haven't even talked about the vitamin D aspect of this as well. It's my belief that nearly every adult in America should be taking some form of vitamin D replacement, but not everybody does. Actually, the majority of people do not. There's lots of studies proving that, and lots of studies recently why so many people do poorly with COVID. Vitamin D deficiency is blamed for a lot of that, besides advanced age and obesity and diabetes and those type things, autoimmune disorders that we know also raise your risk. But, you can start to get better vitamin D levels by, truly getting out there and getting some sun exposure for periods of time. I mean, it's a medical fact that 1 hour of sun a day actually makes us feel better. So take away the aesthetic side of it. Take away the fact that we all feel a little healthier when we got a little tan. Like you said, if you're outside, you're working out and that sort of thing. I'll tell you that I feel better in the winter whenever I, have a tan, even though I didn't obviously get it from the sun. And we'll talk about, I'm sure, how to possibly do that at some point, but it makes you feel better. Because most people like to say, I'm not into vanity. Well, that's probably not so true. That's a give up claim. That just means like, I can't achieve any of my goals, so I've given up, because most of us are all vain in some way. And we want to look in the mirror and be like, okay, I look a little better with a little tan. I certainly look better without love handles or a beer gut, and you feel better, forget what you see in the mirror, you just feel better. But then, so besides that, though, when we're getting the sun, the body is working better, because I personally believe that vitamin D should be called hormone D because it does so many things in our body. And I know there's a lot of other physicians that agree with that, but they'll never change the name of it. But that's just trying to let patients know how important vitamin D is. Now, but I also don't want, let me say this one thing, Steve, before I forget, but I also don't want people to think that it's fairly unrealistic that you're going to get enough vitamin D from the sun in the United States because of how far from the equator we are. So there is a limit to that. That's where like someone may say, well, that's why I lay out 3 hours a day, so I can get my vitamin D levels up. And I'm going to go, well, even if you're able to pull that off, you're causing more damage than good at that point. And I'd rather you just take the 15-cent capsule every day and get your, sun in a capsule at that point, vitamin D wise, I mean.
All right. When I was in Mexico, they want to test you before you can come back into the country. Mm-hmm. So they won't let you come back if you test positive. And so I was like going, well, you only make
COVID test, be positive. Right? Stay in Mexico.
There's that side too. But the thing is, you're out in the sun more while you're there in Mexico, and you're in the pool where there's chlorine. And both of those things are anti-COVID. And so I was asking them, well, how many people test positive and have to stay
quarantined?
And they said very few.
Yeah. It was actually funny. I saw where somebody was telling me that their resort had a clause where if you tested positive, you got to stay for free during your quarantine. I guess that's how they were getting people to keep coming, was with that. So I was like, man, that would be awesome to get quarantined in Mexico. Now, I don't know if I'm assuming they make you stay in your room. I don't know.
You got to stay in this room. They're going to, shove the food under your door. So
maybe I don't want it then.
It's not that glamorous, right?
Can I at least sit on my back porch? Anyway.
So Johnny David's going, I want to do that tan peptide. Talk to us about that tan peptide.
I especially like the face emoji he did there. And so dark skin with blonde hair. I like that. Made me laugh on that one. So some alternatives, obviously, to tanning is, obviously there's spray tans. And, there was a day where we used to do spray tans, and we quit doing them a few years ago. They're just, everybody does them in town. It's not really what we do. And logistically, they cause a hell of a mess. And so we just quit doing it. But spray tans can be an absolute alternative. It's an inexpensive route to go. The things I would say about a spray tan is they're a non-protective tan. So, it's basically just like a highlighter. It's kind of, it's highlighted the skin, but it's not actually giving you UV protection. So, anyone that gets a spray tan should absolutely still use their sunblock as if they do not have a tan. And obviously spray tans can be kind of iffy with your skin tone. Some patients will say, they kind of turn orange with spray tans. And so I will tell you that the fact that we used to do it, that not all spray tans are the same, the manufacturers. And they're just, guys don't typically like spray tans. They kind of smell kind of bad. You have to keep them on for like a day or 18 hours. And I used to hate spray tanning. I smelled so bad. You look so weird, for like 12 hours till you can take a shower. The sheets in the morning, to wake up and there'd be stuff everywhere. And I just didn't like it, but they're obviously an option. And some patients really like them. It's a cost-effective option, but it is not protective. And then there's, of course, peptide therapy. And the most common peptide that patients talk about, there's melanotan 1 and melanotan 2. Melanotan 1 is basically the grandfather to melanotan 2, if you want to say it like that. Melanotan 1 actually doesn't cross the blood-brain barrier, but melanotan 2 does. And melanotan 2 actually naturally stimulates the melanocortin system and the melanocortin system is the system that tans us. So basically we're getting a tan, but we're not actually getting exposed to UV rays. So I can get a natural tan that is protective, somewhat. I always say somewhat protective because I never want a patient to think that means we can't burn. We can burn even when we've had a tan, but without getting those harmful UV rays. So, and there's been lots of good studies done in European countries and Australia actually showing, for the most part, patients will show a decrease in skin cancer when they're using these type of products. And I believe that's simply because at that point, you're not feeling the need to get exposed to UV rays. If you have a tan, if you've got you're happy with how you look, and when you look in the mirror, you're not going to feel the need to go out there and lay out in the sun and get more of a tan with UV rays. So those are some really nice things with it. Melanotan is one of those things that I've been able to even have patients that can't seem to tan in the sun because they burn before they tan, actually be able to get tans with the use of melanotan 2. So that's always been kind of nice. It has, because it is stimulating the melanocortin system, sometimes patients can experience some nausea with this product, sometimes even increase in reflux. Sometimes we have to kind of play with the dose a little bit to calm down those, but that's the most common side effect that we notice that actually patients are concerned about. But it also has one other kind of, most of the time, well-received side effect, and that is increased libido in men and women and increased erections in men. So that's the side effect most of the time no one complains about, but that certainly can happen. And just fun fact to the side, that is where actually PT141 came from, which is the ED and libido peptide. They actually saw this with melanotan 1 and 2, and the scientists and the researchers were able to figure out which amino acids were doing that, and basically cleaved that peptide and, basically shortened it. And we're able now to cause those effects of increased libido, increased erections, but not get a tan. So sometimes patients will come in and say, well, I want the melanotan because I have some ED and I want a tan. And that can work at times. I just always try to say, though, you got to understand PT141 is a much more concentrated peptide that's specifically for those where, if you're young and healthy and blood flow to all the important places are good, then that will probably work. If you're a little bit older, maybe you have true organic erectile dysfunction, it's probably not going to work. The melanotan, with those effects.
So it's a signaling agent, so it's not working in a similar fashion as the ED medication that increases blood flow necessarily, wrong?
Correct. So PT141 or melanotan work completely different than your Cialis, Viagra, Levitras of the world. Those are causing vasodilation, increased blood flow, actually everywhere. But we're hoping to get enough increased blood flow to the down yonders to increase erections. Whereas PT141 or melanotan is actually working through that melanocortin system to actually increase the signaling to increase the erections that way. It also can be very useful. I'm kind of going off to the right, but with PT141, it can kind of be useful with those guys that I have found that have maybe some mental blocks with erections at times, because so much of ED, in my opinion, can be just as much mental as it is organic, actual blood flow. So I like that peptide in that way to be able to help. So if I know the couple well, and I feel like they have a sense of humor, sometimes I won't tell them about those side effects and I just let them tell me later. But that's just kind of a nice sidebar with the medication. And so most providers will prescribe it at bedtime, the melanotan, because that way if there is any nausea or maybe a little bit of increased reflux, it will be not so bad because you're either asleep or at bedtime. And so typically like myself, I won't use this peptide all the time. I typically, now I'm talking about personal use, I will use it at the beginning of spring and summer to basically get I always call it my base coat tan.
Right.
And then typically I will get enough sun in small increments that I will be able to maintain my tan through the summer. And then typically November-ish, December-ish, when I'm getting, as pale as a piece of paper, I will then do another round that will typically take about a month to 6 weeks, which will then push me off into the spring where I've lost that, which kind of like right now. And so for myself, that's typically how I do it. It's popular a lot of times to use melanotan, like just right before swimsuit season. So one thing I used to do, even as a physician, I hate to admit this, but I had a bad habit. We'd go to Mexico. I would drink too much on the first day, and I would end up with like a 2nd-degree burn nearly on day 2. And the rest of my vacation was miserable because I would sunblock in the morning. I have to sunblock 3 or 4 times a day to actually not burn if I have no tan. And, the first one went well. The second one was kind of halfway there, and then that was it. So I used to so there for a while, because we'd go to Cancun every summer or Playa del Carmen, I would always tanning bed for about 2 weeks prior, just like 10 minutes at a time to at least get. And the theory I use there as well, a little bit of a burn is probably better than that really severe burn, because when we peel, we know that we had some severe burning, and peeling is not a good thing. Okay. And so that just shows us that we did some decent damage, as you talked about earlier. So now though, I can use melanotan. I can avoid that tanning bed completely. I can use the melanotan before I go. I can get that tan that I need to give me somewhat of protection. I still need a sunblock. especially in Mexico. The closer you get to the equator, the more intense that sun comes. Anybody that's ever been to Mexico can tell you like 15 minutes there is like an hour and a half here. It's just intense. And so back when I was in the Air Force, we went to Guyana, which is right by Brazil, and it's really close to the actual equator. Man, that sun was really intense. So, I mean, there really is something to the closer you get to the equator. You got to be close. You got to be much more careful.
So this melanotan, how do you take it? Is it, do you take it every night? Is it an injection? Is it oral? Give us a little insight about that.
So melanotan is an injectable peptide. And most providers will have you inject it with a insulin syringe, which is the smallest needle that'll penetrate skin. I actually had a customer a few days ago that was talking about a totally different peptide, and I said it's injectable, and his eyes got really big. I mean, it was like, and he literally said, "No way, doc, I cannot do anything that has a needle on it." So the little guilt that I always do to my patients is I have my assistant go grab a insulin needle, and I'll pull up my shirt and I'll just stick myself like 3 times in a row. And I'm like, really? You can't inject yourself with this little bitty needle? And he's like, oh yeah, that is a tiny needle. I could probably do that. And so, cause I talk to a lot of providers and they say, I can't get my patients over the thought of an injection. I go, what, did you show them what it actually is? Like, I mean, cause when you say shot, we all think of like Nurse Ratched at the doctor's office with that Rocephin shot or that steroid shot. Yeah, that's not what we're talking about here. No. So it is an injectable. It is using a 31 gauge insulin needle. It's practically painless. And as far as how to take it, so typically most providers will dose it multiple days in a row for typically anywhere from 7 to 14 days. So you take it for 7 to 14 days. You kind of, because you have to build up that tan. Okay. And then after that, we go to maintenance. So I typically tell my patients, when you feel like you've gotten to where the tan that you're looking for has been achieved, I also want to make sure that they have realistic expectations and what kind of a tan they can get. So I'm like, how much are you looking to tan? How many shades are, if they're like looking like me and they say they want to look like, what was that guy's name? George Hamilton. Do you remember him?
Yeah, I do.
Yeah. I want to look like him. I'm like, well, that ain't going to happen. But making sure that it's like weight loss. I want to make sure that they have realistic expectations. I want to weigh 98 pounds. Okay. You're 220. That's not realistic. So that's the first thing. But then secondly, saying, okay, go to the point to where you feel like your tan is where you want it. And one little tidbit I do tell my patients, because the most common callback we get is this scenario: moles and freckles darken first before the skin. So I do have a lot of freckles. And so when I take melanotan, I know it's starting to work because my freckles darken. I don't really think anyone else notices it. Like I imagine if you walked up, you wouldn't be able to tell a difference, but it can freak a patient out because they think that, oh my God, now my moles and my freckles are darker, but my skin's not going to. But actually after about 2 to 3 days, then the skin catches up and it's a very natural looking tan. I also make sure that all my ladies know that it darkens everything. That's including like areola, labia. I mean, it's not like the sun where if something's covered, it's not tanning. So it's a full body tan. So that's another thing that some patients don't think about until they tan, unless they've been nude tanning in like a tanning bed. And then after they've achieved it, which is typically 7 to 14 days, then we go to a maintenance therapy, which is typically once to twice a week to just keep their tan. So we do a little bit less each day for like 7 to 14 days until they reach their tan. Then we do a little more, but twice a week to once a week. I personally do once a week. That's usually enough to maintain my tan. It makes the vial last a little longer that way.
So what are some of the other benefits other than tanning and the increased sexual function?
Yeah, so the reason I had said melanotan 1 versus melanotan 2, that I had said melanotan 2 can cross the blood-brain barrier, is actually melanotan 2 has shown some actual benefits wellness-wise with use of melanotan 2. It can decrease inflammation in the body. There's a lot of doctors that use melanotan, and I've done this too, that use melanotan not just for a tan. It's like, that's just a nice sidebar. I actually want some of the anti-aging properties that we can get with melanotan 2, helping better brain function and lower inflammation, and some of these characteristics that we're seeing with melanotan 2, and more than melanotan 1, again, because of the crossing of the blood-brain barrier. So there's more to it than just tanning, but obviously most people who come in requesting melanotan 2 consultations, that's the main reason. And then before I forget, any providers that may listen to this, I do not treat anyone with melanotan that has a history of melanoma. I don't want to stimulate a system that's had a history of melanoma. I also ask them and make sure that there is no active skin cancers. I will personally treat a person that's had a history of basal or squamous cell cancers, the less dangerous ones, but I will not treat them until if they have active ones, like, oh yeah, my dermatologist is about to, do surgery. I'm going to remove this cancer on my nose. We got bigger things to worry about at that point than, having a tan. And I just, I had this debate with other practitioners. I don't necessarily think we're doing anything wrong, but, it's probably just we don't need to muddy the waters at that point if we have an active skin cancer. Let's go get that taken care of. We'll come back to it after that. But melanoma, if you've had a history of melanoma, for me as a provider, it's off the table.
It's a no-go. Does it help you sleep?
Yeah, so some people do experience, because of the blood-brain barrier crossing, it does help sleep a little bit. I don't know if someone came in and said, my main issue is sleep, that melanotan 2 is what I would be going for. That would probably be more like deep sleep-inducing peptide, DSIP. CJC ipamorelin has, I think, more of an effect on sleep than melanotan, but certainly won't harm sleep and may help it somewhat. So it certainly can be in the conversation for sure. Sleep is that topic that we probably need to do a sleep podcast at some point. And I wish I had all the answers for sleep. Personally, I wish I had all the answers for sleep. My sleep has gotten better, but as we age, so many of us, our sleep starts to worsen. And man, I think we all know out here, there's like, that we can do overall for our wellness. Actually, it was funny at our conference this weekend. We were talking about sleep, and Dr. Seeds was actually lecturing one of our counterparts about, she works nights. She's an ER physician who works nights and does age management during the day. And he was trying to talk to her about how horrible shift working now is actually considered a carcinogen. It actually raises your risk for cancer. And so he was kind of talking to her about how horrible shift work can be for you. And somebody said, well, how many hours do you sleep? And he's like, yeah, let's not talk about that. My sleep's horrible. And so, we all talk about sleep, and here's what we can do for sleep. And Lord knows I have so many more tools in my toolbox for sleep today than I did a few years ago, but it can still be a quite perplexing issue, because it's not like low testosterone. Somebody comes in, I've got low testosterone. I know how to fix that. I can guarantee you I can fix your low testosterone. I can't guarantee you I can fix your sleep. And, some patients just aren't always willing to do what they need to do to fix their sleep as well. If my wife is listening, she's maybe one of those people, because you got to set routines. You got to follow the routines. You can't do it today and not do it tomorrow and expect it to work in 2 weeks. Sleep's tough. So that was a long answer. Yes, it can help some. Not my go-to, but it can help some.
Okay, so in your clinic, what are some of the things you do that help people have a better skin during the summer? So are there some treatments or?
Yeah, absolutely.
Yeah.
The proper skincare is probably most important. Okay. And so typically it's not money. Like I used to think, because pharmaceutical grade, physician only skincare, pharmaceutical grade skincare can sometimes be thought of as very expensive. And it's certainly not cheap. But what we've learned is that most women actually spend that amount of money, if not more, on products that don't work or are not right for their skin tone. Okay. And Because the thing about pharmaceutical grade skincare, like in our office, we mainly sell a product called Zeo. And Zeo is absolutely one of the best skincare lines out there. You use so much less of it. Like I say, like with this products, because they're so potent and they work so well, we are typically telling our patients to use smaller than a pearl size of applications. So most of the products that they buy here last 2 to 3 months versus 3 to 4 weeks. So even though we're maybe 15% more expensive than what they're normally buying, it lasts 2 to 3 times longer. So it ultimately ends up cheaper. But whenever you're actually coming in and meeting with one of my skincare experts who've gone through a tremendous amount of education, they're matching your skin tone, your moisture with the correct products versus I went to Dillard's and this lady at the counter who sold me some cologne and some perfume for the wife sold me the skincare. And it's like, okay, probably not the best stuff. Sometimes the products are good, but it's like, well, that would be good if you had oily skin. You've got dry skin. So the first thing I would tell anyone is coming in and getting actual skin consultation. We don't charge for those. We're not pushy salesmen. We tell you what we think you need. We price it out for you. You make the decisions. Many times we'll give them, even though we're told not to do it, we'll give them samples and say, hey, try this for 2 weeks. If you love it, come back and buy it. If it's somebody on the fence. So skincare, sun blocking, even though I admit I'm not as good about it and I'll regret it one day. One day I'll say, damn it, I should have done that, even though I didn't as much as I should have. So skincare, sun blocking. But then when you actually get into actual procedures, for those maintenance, we really try to talk to our customers into doing monthly hydrofacials, which is a very relaxing procedure where we're basically taking off a few of those dead layers of skin and actually pushing hydration under the skin. It is not painful. It's a very actual relaxing procedure. And it's best that we do that monthly. That's where you get the most bang for buck. And that is not, in my humble opinion, a costly procedure. And then we can apply different growth factors and different add-ons to that, but that gives really good results. And then most of the time, that's where it stops for a lot of patients. Good skincare, hydrofacials. We have a hydrofacial membership that makes it very affordable. That's enough for a lot of people. But extra stuff could be the Luminate, which is the GHKCU topical peptide. That's an amazing peptide. Medical studies have shown a lowering of depths and lines of wrinkles up to 40% and an increase in collagen elasticity up to 70% after 60 days. We've had tremendous results with that product. And then on top of that, for the patients that maybe now they're walking in with the damage already and they didn't follow these things because they didn't know any better, that's when you start looking into like the lasering type of procedures to actually literally further than we can go down with hydrofacial or with Luminate, actually going down and taking off layers of skin to actually somewhat try to get down to a more virgin skin so that we can get rid of hypopigmentations and just the stimulating the collagen to repurpose so that they get tightening of the skin. And because a lot of ladies, especially ladies, have a lot of hypopigmentation issues because of sun damage and pregnancy. Pregnancy for a lot of ladies really causes them to have hypopigmentation because of the surge of hormones that they have. And that's called melasma. And a lot of ladies have melasma and they just cover it up with makeup and whatnot. And it's tough to treat, but sometimes we can really help it with some of these different procedures.
So I didn't notice this comment in the time you were talking about sleep, but this person here, Kris.
Yeah, she is her and these moons. She always tells me like super lunar blood moon. I don't keep track of the moons. Moon doesn't bother me a bit. She claims she can't sleep when all these moons are out. So I don't know. That's some wacky lady. We'll let her keep going. But yes.
So what do you do about age spots? Some people, I've got some, went to the dermatologist because I didn't know if this is, an early sign of skin cancer or whatever. But he made a comment. Yeah, I can give you some stuff to take those off. What's he talking about?
Yeah, so there's actually Well, going back, there's multiple ways. So what we want to do is we want to prevent them if we can. All right. So all the things that we just talked about, we didn't, you know what? Thank you. Actually brought up a good topic. What are, besides looking older, what are one of the things we can do? We can start to get age spots. And unfortunately in our age range, we start to get these age spots. And what are age spots? They're actually from sun damage. And you know, so how we take care of our skin genetically, some people have more age suns. So I call them sunspot, age spots, liver spots. I've heard everything. So there can be multiple things, but they're all the same thing basically. So protecting the skin is the most important thing, and hopefully never getting to that point. But once we have them, depending on what it actually is, sometimes you can freeze them off, but most likely you're going to take a lesion that had hyperpigmentation and now hypopigmented. So actually now the spot still shows it's now lighter than the skin than darker than the skin. So most dermatologists are going to tell you that's probably not the best idea. Mm-hmm. If it's actually a lesion that they're concerned about that may turn into cancer, that's called an actinic keratosis, AK. 1 in 20, I believe, turn into cancer down the road. They will either freeze those off, or they will actually have that cream that you put on that actually is a chemotherapy cream that actually, and I've had to use it a couple times. It is not fun. I mean, it'll blister you and peel to basically get down up under that lesion. Lasering can sometimes help. You know, no dermatologist, if they think it's a cancer, is going to tell you that's the treatment. But if it's benign spots, again, hypopigmentation changes, that can help. There are some different creams and lotions out there that can help with some of those things as well. And so that's where a good just skincare consultation comes in.
All right. So we've covered some preventative. We've learned what it does. We've learned about some peptides, some treatments, some sleep stuff. Now, we always talk about ketone esters. I'm sure there's something going on with ketone esters. And
I won't have a hard time bringing that one into this topic. Yeah, so maybe it'll give you more energy to go outside and get a few minutes of exercise while we're getting a few minutes of tanning. Maybe, I don't know. I'm gonna struggle to bring that one into this topic. But I love my ketone esters. So.
Yeah, I do too, because I take a capful before I go to sleep. I believe that it helps me rest deeper and more. I get a better sleep. It's interesting.
So the only thing that I would say in a capful is perfect is anyone that wants to try that, be careful of not taking too much at bedtime. Mm-hmm. So for a lady, that would be half of it. So a capful is 5 mLs or cc's. And I think guys can do perfect. I would not go above 5 cc's before bed. And I think ladies should do half that amount, 2.5 cc's. Frank actually says possibly even less than that, like 1 cc. And I'm like, unless you have a syringe, how do you get 1 cc? Right. So I think half a cap is really good a few minutes before bed to help you sleep. But I've been amazed at, especially when you go to these conferences where there's tons of people there using it that are actually getting a lot of success. Need to do a concerted effort to try that, because I don't have any issues going to sleep so much if my wife will go to bed and not watch TV. My issue is actually staying asleep and getting deep sleep. That's what I struggle with. And so I know this isn't a sleep one, but we're talking about sleep a little bit. Sleep monitoring is so important in my opinion. I think if someone has $200 or $300 that they can spare to spend on their health, and they may already have these devices, but a Fitbit, an Apple Watch, my favorite, of course, is the Oura Ring, OURA ring.com. It can really give you invaluable data on your sleep, because as I tell my patients, if you think you may struggle with sleep, maybe you don't even know you struggle with sleep. You just don't know why you're tired. But you can actually have objective data to compare to. Okay, I instituted ketone esters before I went to bed. I subjectively feel better, I think, but I objectively can tell that my sleep scores are improving. And so for me, that means a whole lot. It's kind of like a body composition test with weight loss for me. If somebody's 250 and they go down to 150, well, then yeah, it probably worked. But most of my weight loss patients are trying to lose 5 pounds, 8 pounds, 10 pounds. I don't know what that means if they say they lost 3 pounds unless I have a body composition test to look at. Same way with sleep. Like, well, I think I'm sleeping better, doc. Well, okay. What does that mean? I really think that the sleep monitoring can be a invaluable addition to your wellness toolkit.
All right. If you've been listening, Dr. Kris, and you convinced us that we need to get in contact with you, what's the best way to contact you? How would you onboard us? What would it look like to get our butts in shape, looking good, rested for this summer?
Well, here's the great news. And I don't even know if I've told you this. I've hired a nurse practitioner since the last time that the two of us talked. And Maggie's deep in training on all things that we do here. So because we're needing help accommodating our patients, because we've been having a little difficulty actually getting everyone in for their appointments. So we're hopefully going to make this process even easier very soon, because we're going to have a second provider that's going to be here full time. But simply, you can go to our website and, you'll find all of our information. The easiest way is, we love patients, just pick up the phone and call us. We're still a little bit old school like that, although we do respond to emails and those things. But the quickest response time is pick up the phone and call us at 817-599-9902, which you can find at our website that you see on the screen. And probably most likely, lovely Inez will answer the phone, and she'll tell you how to get you in, and get you in with Maggie or myself, or right now both of us, because right now you get 2 for 1, because she's training, and we'll walk you through this process.
All right. And then Lorinda is the one that's going to help you with all the skin stuff and other.
Yep. Lorinda is our skincare expert. Lauren has also been our skincare expert. Her last day is tomorrow, but we're going to quickly get Maggie trained up to where it's Lorinda and Maggie doing all of our skincare stuff, along with Inez.
All right. Well, another excellent episode. I enjoy this. Since I started talking with you on these on a regular, Dr. Kris, my health has improved. I've lost weight. I do intermittent fasting, do the ketone esters, even some of the peptides, and I can do the needles. So
they're not bad, right?
Yeah, it's not that bad. Every once in a while, I'll actually feel a little something, but I'm not an expert, right?
Pretty rare though, right?
Yeah, very rare. All right. Well, we'll see you guys next week. If you have some questions, be sure to submit them on the Facebook page. And this is Peptides and Age Management with Dr. Kris, Dr. Kris Wusterhausen of the Research Clinic. And again, it's theresearchclinic.com. And we'll see you guys next week.
Thank you.
And that's a wrap. Thanks for joining the Dr. Kris podcast. If you learned something today and you want to connect and get more information, visit our website, www.DrKris.Life, where you can find more great information or even schedule a time to learn how you can engage with Dr. Kris. Be sure to follow, like, share, and we'll see you on the next episode of the Dr. Kris podcast.